So hi everyone, my name is Rebecca Murphy and I work for Jigsaw, the National Centre for Youth Mental Health. And I am a Youth Mental Health Promotion Coordinator. So part of my role is working with communities, with young people and with adults who work or volunteer with young people around promoting and supporting their mental health. So people like yourselves who are coaching young people, who are volunteering with young people within the kind of FAI context, but also as well maybe working with them as well professionally. So I'm going to just bring you through, sort of introduce Jigsaw to you as an organisation, and I'm also going to talk to you a little bit about the One Good Coach online program, what it's all about, and maybe kind of go into depth on a couple of other bits and pieces within it. So I'll be talking to you probably for about 40 minutes. I think I might go over that, might go under it. I'm not the best at sticking to time sometimes either way. So we'll go ahead and hopefully you'll find it interesting. So I suppose just to kind of let you know, some of you might be familiar with Jigsaw already. Jigsaw is the National Centre for Youth Mental Health. We were founded in 2006 by a guy called Dr. Tony Bates. So Tony is a clinical psychologist and he was working for years in St. James's Hospital with adults who have significant mental health difficulties. And what he noticed was that something that came up time and time again when he worked with those adults was they'd say to him things like, if I'd had someone to talk to when I was 13, 14, 15, 16, that perhaps actually things might have turned out differently for me, that perhaps I may not have gone on to have developed such severe mental health difficulties that required such long-term treatment. And that's what inspired him to found Jigsaw. And we were originally called Headstrong. We had Jigsaw services around the country, but our kind of central body was called Headstrong. But now we're all Jigsaw. We're a one big Jigsaw family now around the country. And I suppose to kind of give you an idea, like our vision as an organisation is an Ireland where every young person's mental health is valued and supported. And how we kind of are reaching for that vision and the mission of the organisation is we advance the mental health of young people aged 12 to 25 by influencing change, strengthening communities and delivering services. So currently we have 14 services. We've got another one just coming on stream, so 14 around the country. And I'm going to bring you through kind of a little bit of how they operate. And I suppose the thing is with Jigsaw, we have young people at the centre of everything we do. And in terms of our services, they're for 12 to 25-year-olds, they're a free service, they're accessible. You don't need a GP's referral. A young person can ring up and make an appointment themselves. They will need parental permission if they're under 18. A parent can refer a young person. And these services are located, as I said, in 14 different communities around the country. To access that community, to access that service, a young person needs to be living, working, or going to school within that catchment area of the service. So some of you may not be within a Jigsaw service area, and I'll show you what kind of supports and services we might have for you as well online. Our services are early intervention. So Jigsaw places itself at the kind of mild to moderate end of the spectrum of mental health. So it is with young people who might have mild and emerging mental health difficulties. So it's not a long-term service. It's not a long-term psychological intervention for young people. It's a short-term early intervention service. The next thing that we do is around that strengthening communities pieces. So we try and make our services in Jigsaw as accessible as possible to young people. We try and reduce as many of the barriers as we can, but we know that not all young people who are having difficulties with their mental health need to come to a service. Not all young people who may need to go to a service will go to a service, but we also know that a young person who comes to Jigsaw, they come from a family of some kind. They have a community around them. They might be going to school, might be going to work, might be going to college. They might be playing football. They might be involved with the GAA. They might be involved in a lot of other youth clubs, things like that as well. And so I suppose what we want to do is we want to focus on that community aspect as well and building the capacity of those communities to be places where young people's mental health is valued and supported. So what we do, say in my department, for example, is we look at building kind of promoting and supporting mental health of young people in the places where they live, learn, work and play. So it's not just about the individual young person, but actually about the community and the systems around them as well, and what they can do and what you can do as adults who work or volunteer with young people. So things like workshops, working with communities. We have a youth advisory panel. We would have an awful lot of links with communities where our services are, and we would have a lot of collaborative work as well with different organisations. So obviously the FAI is a partnership that we're really happy to be involved in. We'd also partner with other sporting organisations, with organisations like Belong To. So we would work with an awful lot of different organisations around that. Another part of our work as well is influencing change. So that's looking at really changing the kind of national and local conversation about mental health. And we do that through research, through our collaborations, through campaigns, through work with government partners and that as well. So that's a really important part of our work. And I'm going to talk about a piece of research later on as well that links very much with that. And so these are all kind of really the three main pillars of our work in Jigsaw. Um, Mental health is a really key issue for young people. And I suppose that the reason why we work with this 12 to 25 age range is that we know that people who go on to develop mental health difficulties tend to have experienced issues before the age of 25. So you can see that there's just this one piece of research from 2005 shows that 75% of adults who are diagnosed with a mental health disorder have experienced mental health difficulties by the age of 24 and 50% by the age of 14. So that 12 to 25 age range actually is a really major age range for mental health, for that emerging kind of difficulties. And it's also important for us that we work across that age group, that it's not that there's a different service once someone turns over 18, that actually we work across that whole lifespan because it's such a crucial time in terms of our mental health and our development. And I'm sure that a lot of you work with that age range and you'll agree as well around the kind of the changes, the kind of the often turbulent time that can be for a young person between the age of 12 and 25. And so that is why we work with young people. And when we talk to young people, whether it's through our advisory panels, through our services, they always do identify mental health as being a key issue. And young people that we work with, the young people that we have surveyed through My World Survey as well, mental health is a key issue for young people. And that's why we work with young people at that age range. One of the ways that we as I mentioned earlier, that we engage with young people, that we try and engage in that influencing change pieces around pieces of research, because we really want to know what's going on for young people. We don't want to be guessing. We don't want to be making it up. We want to be really working on evidence and being led by that evidence. So these are two major pieces of research that we've engaged with over the last, over the last few years. So in 2012, the My World Survey 1 was released, and this was a collaboration with UCD, the School of Psychology there. And then they did a follow up to it, then that was published in 2019, which was the My World Survey 2. So the My World Survey 2 talked to over 19,000 young people between the age of 12 and 25. And it's the biggest research ever done on mental health in Ireland and young people. You can download the full research from myworldsurvey.ie. And we asked young people a lot of different things in that. So we asked them about how they were feeling in terms of their experiences around feelings of depression, anxiety, and stress. And we did that through a survey or through a piece of what's it called? A research tool, sorry, called the DAS. So the DAS 21 is a depression, anxiety, stress scale where people rate themselves against a number of statements. So in the past week, I have felt there was nothing to look forward to, and I have felt a tightness in my chest. I have my brain's gone blank now, obviously, when I'm trying to describe more than statements. But and then the person would rate never, sometimes, often, or always. So it's a snapshot of the space of about a week or two. It's not a diagnostic tool. So if someone scored kind of out of the normal range for feelings of depression, we're not saying they could walk into their GP surgery and get a diagnosis of depression, for example. It's very much looking at what feelings are going on for them at the time. And what the My World Survey 2 found was that 40% of the adolescents that we surveyed within this had mild to severe feelings of depression. So that's a large range, obviously mild to severe. But what that means is that it's outside of normal range. So some amount of low mood is normal. You know, as human beings, you know, we all have mental health, and all of us kind of experience ups and downs. So some amount of low mood is normal for all of us. But when it starts to interfere with function, with the ability to engage with life, with school, with the things that they want to do, that's when it starts causing an issue. Similarly, we found that 49% of the young people were experiencing mild to severe feelings of anxiety. So I think it's always about kind of being aware that the numbers were quite high in the My World Survey too for these feelings of anxiety and feelings of depression. And it is quite interesting to look at like some of the things that were linked with that. And we will talk about things like the one good adult and other kind of protective factors later on as well. But it is kind of it's not an uncommon issue for young people to struggle with feelings of anxiety or feelings of depression. And I think that it's something to be aware of when we are working with young people. So I suppose the Jigsaw way, really, in terms of how we work with young people, is around that prevention and early intervention piece, as I mentioned. It's also kind of about that, you know, the fact that our services are available for 12 to 25-year-olds. Young people are centrally involved. It's about that mild to moderate mental health difficulties. And what we offer to young people within that is brief goal focused sessions. So there's 1 to 8 sessions, and there's a lot, and our clinicians work with young people throughout those sessions around setting goals, what they want to achieve. And for some young people, what they want to achieve is they want to be able to speak in class, and that can actually be one of their goals, to actually talk in class and not feel anxious about it and not feel nervous about it. Or it could be about making friends, or it could be about taking up a new hobby. It really is led by the young person and what's going on for them. And I suppose the really important thing around Jigsaw is that it's about offering the right help at the right time in the right place. So you can see from the images there that our services are very colourful, they're very friendly, they're very youth friendly. It's about being accessible and inviting for young people, and it's about being non-stigmatizing as well. So that when we ask young people what do you want the service to look like, and I mentioned kind of we have a youth advisory panel, and they help us to design them, they help us to pick out the furniture. Young people tell us they don't want it to look like hospital, they don't want it to look like a doctor, they don't want it to look like a school, a prison. That they want it to be somewhere friendly and comfortable where they'll feel able to open up and talk to our clinicians. So this is an example from a few of our different services, but they're all very similar. And yeah, we spend a lot of time in IKEA really when we're setting up services, as you can see, and the colours as well are really important to us, to make us kind of a more friendly, inviting place, basically. And I always think we talk about this in the context of young people, but I think any of us, if we were going to a mental health service, we want it to be friendly and nice and colourful and welcoming as well, So I think it's really important to do that. In terms of the mental health service framework, just to kind of show you this sort of framework for how it works in Ireland. So kind of at the bottom of the triangle is what we call the community supports. That's actually people like yourselves, people in kind of clubs, in youth clubs, in schools, teachers, things like that offer that sort of support to young people in a very informal kind of a way, family, friends, self-help, other community groups. So that's kind of the largest support that's available to an awful lot of young people, which is why we do so much work in Jigsaw with that group. The second level then is the primary care level, and that's where you get kind of your early intervention stuff like your GPs, public health nurses, psychology, kind of you got your social workers, kind of SLTs, community mental health nurses, things like that. Sorry, SLT is speech and language therapy. I shouldn't be using acronyms really, but just it's kind of a habit sometimes. And then the kind of top layer of that framework then is kind of secondary care, your inpatient care, your tertiary care, and so the kind of more specialized services. Jigsaw, as I was kind of saying, would be within that sort of middle kind of primary care level. So we're an early intervention service. If a young person needs very specialist care, if they have maybe moderate to severe difficulties, and they would need to access secondary or tertiary care. If a young person comes to us and they're outside of our scope of practice, we will support them to try and access a service that is more suitable for them, and as best that we can, and that all young people will get an assessment to see if they are suitable for our scope of practice and how we at work. Areas with a local Jigsaw service then, so you can see these on the map. There's actually an orange section missing there. The Tipperary is going to be opening up in the next couple of months, and Wicklow is actually the newest service. So you can see that we're kind of spread out over the country, and I suppose our vision is that all young people should be able to access a service like Jigsaw. But as you can imagine, it's about funding and it's about kind of that rollout. So we are expanding. So as I said, we've opened 2 new services now in so Wicklow, Tipperary, and then we opened 3 more before that as well, in Cork, Limerick, and Dublin City as well. So we are expanding over the years, and we hope that all young people will be able to access a service like Jigsaw over the coming years. So as I said, young people can refer themselves, professionals can refer in as well, and parents and guardians. So we try and cut down those barriers. As I mentioned, some of you may not be able to access a physical Jigsaw service, but we do have a lot of services online as well for young people, for parents and guardians, for those who work and volunteer with young people. So for information and videos, articles and things like that, you can see jigsaw.ie is our website, and there's an awful lot of information and e-learning there as well. So one aspect of my job is developing e-learning courses for teachers, for coaches, for as you know, the One Good Coach is part of it, but we also would have courses around self-care for teachers. We've got courses for parents as well. So I would, if you want to log on to jigsaw.ie, you'll see some interesting courses and information and a lot of articles and things like that as well around supporting the mental health of young people. And there's a lot of content for young people as well, developed by young people. There's also things like Ask Jigsaw, where people can email in questions, and those questions are answered on the website then anonymously, obviously. We also have some kind of chats as well available, where we have clinicians, Jigsaw online clinicians available to support young people. So you can see that there's Jigsaw online group chats, and they're facilitated live by a Jigsaw clinician, and there's a timetable and there's registration, so they're for young people. And then there's a Jigsaw live chat as well if a young person wants to get one-to-one chat or one-to-one support, sorry, from one of our trained staff members. And they can talk about what's on their mind, or they can send us an email as well, and you can find out more around all that on jigsaw.ie. So there are some supports available online that are available to people wherever they are in the country. So I would advise you to kind of take a look at that if you're interested in hearing and seeing any more about Jigsaw, or if you're wondering how Jigsaw might be able to support you or a young person in your life. So just as you can imagine, COVID had quite an impact on the work that we've done over the last year, and actually is in a full year now at this stage. So we had to pivot an awful lot of our work from what would have been face to face. So obviously things like this webinar would usually have been so One Good Coach, the course itself, actually is a conversion from a face to face course, and that kind of has picked up an awful lot of speed in terms of organizations like the FAI wanting a version for their members as well, because we're not able to get out and talk to people face to face. But you can see that we've had to move some of our physical Jigsaw services to phone and video supports that we offer to young people. We've got an awful lot more of online offerings across the board. We offer a lot of webinars. We offer contacts through kind of our learning management system. We've got a lot of different things going on, and you can see some of the numbers there. I'm not going to read them out, that there's been a huge amount of work done for us in terms of moving to online services. So we've been engaging in e-learning work within our department for the last 2 or 3 years. So we were kind of lucky in one sense that we'd had an awful lot of the groundwork laid when COVID hit. Like, if it's possible for a pandemic to come at a slightly better time, it probably did. If it had come the year before, we would have been in a much more tricky position in terms of moving things online. But we actually were able to kind of convert an awful lot and do an awful lot. So we're delighted to be able to still meet people. We're delighted to be able to still work with people and to continue the work that we do with young people, even when everything is so bananas. So it is great to be able to do that. What I'm going to talk to you about now is actually the course itself. So One Good Coach. So One Good Coach was developed about 4 years ago now at this stage as a face-to-face workshop. And basically we did consultation with coaches across a number of different sporting backgrounds, from football, from GAA to martial arts, across a number of different areas. And we talked to a lot of coaches around what they wanted. And what came about was this workshop, which the face-to-face version is about an hour long. And it was very much just kind of it's not a workshop where we tell you how to coach young people. That's not our expertise. That's not our wheelhouse. We're not here to teach you how to coach young people. What we are here to talk to you about is how you can use your position as a coach to promote and support the mental health of young people, because you have such a unique relationship with young people that you see. Obviously, at the moment we're a bit limited, but in the normal times, young people that you could see week after week, possibly more than once a week. You see them during the highs, you see them during the lows, and you can really kind of, sport really can bring the best out of people. And I think that having that unique relationship where you're working with young people as they're doing something that they really enjoy and something that they find that really helps to light them up when it's at its best, is a really kind of a powerful position to be in when we talk about mental health and young people. I suppose practicalities around the workshop itself. So you need approximately about 40 minutes for the online one. Some people will take longer, some people will take shorter. So I always put the caveat of approximately in these things. You do need sound or headphones for it, because we do have videos and audio pieces in it. And while the workshop itself, what we built it on, so we built it in a piece of software called Rise, which is inarticulate. Some of you may know what that is, some of you won't, doesn't matter. It's mobile friendly, but I always recommend that people use a desktop for these things, because I think you do get a better experience. Even when they're very mobile friendly, I think it is better, but you don't have to. You can do it on your phone. And the things that we cover within it then, so we talk about what is mental health. We look at the importance of one good adult, which some of you might be familiar with, some of you may not be. We talk about tips for promoting youth mental health in your work as coaches. And I suppose just to say as well, the last thing we want to do is put more work on coaches. This is very much about stuff that you might already be doing, or just little things that you can do, kind of integrate into your work to sort of up your mental health promotion game, I suppose. And then I suppose as well in the workshop itself, we talk about what is the Jigsaw service. So you've already covered a lot of that, so it'll be just revision for you, but there isn't a huge amount of that in it anyway. One of the really important things we talk about within the One Good Coach, and I mentioned it earlier, kind of, is the idea that we all have mental health and that we're all on that scale of mental health somewhere. And the mental health scale goes from poor on one side to good on the other. And where we are on it kind of changes and moves around kind of day to day, week to week, month to month, year to year throughout our life, depending on what's going on. So that our environment around us really does impact on our mental health. But the important thing is that we're all on it there somewhere. And I think that the beginning of conversations around mental health and at the beginning of our work around promoting mental health for young people is kind of acknowledging and accepting the fact that we all have mental health, and that it's actually a part of being human. It's not something to be stigmatized. It's actually something that is very natural and normal, that we all have it. It's not a fixed state. We move around it. Some days we'll feel better than others, and that it is about kind of the human experience. It's not about the 1 in 4s. It's not about the 1 in 5s. It's about the 4 in 4s and the 5s and 5s. And one of the other really important thing that we talk about is the idea of this one good adult, which came out of the My World survey that I mentioned earlier. And what we discovered in the My World survey is the presence of one good adult. So an adult that a young person feels they can talk to, that will support them, that is available to them. It helps to make a young person feel more connected, more self-confident, better at looking towards the future, better at coping with problems as well. And so that one good adult is so incredibly important for a young person. And that's something that we talk a lot more about within the workshop as well. I'm going to share a quick little video with you, just to kind of basically talk more about that one good adult. And it's a video that we made that's sort of where young people talk about their one good adult.
When I'm feeling down and I want to cheer myself up, I listen to music. That's my thing. Getting a new album, going to see a show, singing my heart out, it all helps.
I get out, I go for a walk. It really clears my head.
I do something that puts me in a good mood, like a game of soccer.
I meet up with a few friends, people who make me feel good about myself. My friends are always there for me.
Dance, definitely. It helps me switch off. Get lost in the music and lost in the atmosphere and just have fun.
I go out for a run. That helps me. I remind myself that whatever it is, it will pass. We all have ways of coping when times are tough.
But if all the things that usually help you just aren't working, might be a good idea to talk to somebody.
Talking to a supportive adult can help put things in perspective.
I know I can count on my older brother.
One good adult in my life. Someone I know I can trust.
I talk to my dad.
I have a great relationship with my ma, so I talk to her.
I talk to one of my teachers.
I talk to my guidance counsellor.
I usually talk to my sister.
Talk to an adult. It can really help.
There's always someone around who can listen and support you.
Who might that person be for you?
So that's one of the videos that we made around the one good adult concept, and you will see that we explore that a lot more within the one good coach. Oh, sorry. And the really important message that we always say to people is that we can all be that one good adult, and oftentimes in the My World survey, about 50% of young people identified their parent as the one good adult. But actually for a lot of young people, it wasn't. It was someone else. So it was an older sibling, it was a teacher, it was a coach, it was a youth worker. And it might actually be you, that their coach or their trainer that they're more comfortable talking to, And, when I say kind of talking to you, I suppose for many young people, That might mean they can tell you they had a bad day at school, or they've fallen out with a mate, or they're worried about an exam, you know, and that's what we're saying. It's not about you kind of being a counselor to a young person or a therapist. It is about looking at your own boundaries around what you're able to do and how you can support a young person. But there's lots of those little conversations that can make a really big difference to a young person. And absolutely, if they do need further support, kind of knowing where they might be able to find it, whether it's kind of and how they might be able to access it, so whether it's accessing Jigsaw or maybe another support, that's a really important thing to be able to do, to be sort of a gateway almost for that young person if they need it, or a signpost for that young person. The other thing we talk about within the course is the 5 a day for mental health. And the 5 a day basically is, we're very familiar with the idea of, we eat 5 pieces of fruit and veg a day for, our physical health. And I suppose that idea has been borrowed then to create a 5 a day for mental health. So the Foresight report was published in the UK, and they found that there's these 5 individual things that we can do every day that will help to improve our mental health. And what we would say and what we talk about in the course is that we can use these within our coaching to actually help promote the mental health of young people, and we can try and implement them across the board. So the 5 elements that we talk about are: be active, connect, give, keep learning, and take notice. So I'm sure even when you're looking at this, you can probably think of ways that that sport already ticks a lot of these boxes. Certainly, obviously, being active is the most obvious one, but connection, those connections that young people build up within their team, between their coach and themselves, between themselves and their teammates, and the members of the community as well. Give, so how they can support each other, how they can be nice, be kind to each other, and the kindness they can show, and the good things they can do. Keep learning. There's so much scope for learning within sport as well, in terms of learning new skills, new tricks, different things like that. And take notice then is about being in the moment and living in the moment. And I think actually it's such a useful skill to learn for sport, because so much of sport is about being in the moment and reacting in the moment and trying to stay out of the clouds and down on the ground and down on the pitch where you're supposed to be. And take notice is very much about looking at that. So some of the questions that we'd ask around 5 a day, and this is kind of on top of what we talk about within the course, and some questions that we'd ask you to consider when you're thinking about your 5 a day. And might be something that even while you're listening to this webinar, you might kind of take a moment to think about yourself, because the 5 a day isn't just for the mental health of young people, it's for our mental health as well. It's for everyone. And so it can be really useful for us in terms of minding our own mental health. So some useful questions to think about. So when it comes to, say, connect, so what helps you to grow healthy connections with people in your life? And obviously with COVID, and I think that's one of the most challenging things around COVID-19 and the lockdowns, that not only is it a stressful thing to be going through a global pandemic, and the worry and the stress and the anxiety that comes with that, it also actually means a lot of our coping mechanisms have been taken away from us. So connection is often a big one for us. When we're feeling down, we hang out, or we go out with our friends or whatever. But I suppose what we're asking you to think about kind of for COVID and beyond as well is, well, how do you create those healthy connections with people in your life? And what are the things that help you? And some of us need more than others. So I'd be quite an extroverted person. So I like being around people. That's why I like team sports, because I like being in that crowd. And I'm sure some of you have that experience. But for others, it might be different. It might be a one-to-one chat with someone, going for a cup of tea, going for a coffee. I suppose now it's all about walks and meeting up with one other person for a walk somewhere outdoors. The next one then is be active. So which ways of being active do you enjoy? And again, for a lot of us, the ways we get active have changed because of COVID. So team sports, we're not allowed at the moment. So it's March 16th now that I'm recording this, and we're still in level 5. So we're not able to come together for sports. But what other ways of being active do you enjoy? And what are the things that you can encourage for the young people in your team as well? So not only just kind of coming to training, but what other ways can they get active that's good for their bodies, whether that's kind of even things like yoga and stuff to complement their training, that actually will help them to stay healthy and stay well, or maybe it is just going for runs and building up activity, not just for physical fitness but for kind of that mental health aspect as well. Take notice then as well. What do you notice about where you are and how you feel right now? And that's a very simple way of starting that sort of take notice practice. So mindfulness is often mentioned. Mindfulness isn't for everyone. It can be very difficult for people. It's certainly, when you start off kind of trying to do take notice, going straight into mindfulness can be a bit intimidating. But it is actually just about even closing your eyes and just kind of, what can I hear right now? And sometimes I like doing that during really busy days, which it's not easy to do it on those days, but it's probably the most important days to do it. You close your eyes and say, what can I actually hear right now? And it's amazing the things that you can hear when you just take that 30 seconds to do it. What can I smell? What can I taste? What's going on in the world around me? Not up in the clouds where all the worries are, but actually down here back on earth. And these are really important things. And I think encouraging young people to take notice as well. As I said, I always think that it's a really important skill to be able to nurture for sport, particularly because on the days of the big matches, you could be up in the clouds worrying about, oh God, what if I do this? What if I do that? But actually where you need to be is right on the pitch in that moment, feeling, using your instinct and kind of going with what's going on. So I do think that take notice is really important. And keep learning. What have you learned or tried out for the first time recently? So lots of us have developed new hobbies over lockdown. I think my knitting game has just reached I mean, I've always been a bit of a granny, but like I've just gone to another level entirely now. But so we've all kind of gained new skills, and I know as well that I see a lot of kind of sports and stuff doing sort of skills challenges on Twitter and Instagram where they're learning new skills in the back garden and they're demonstrating them, and it kind of becomes like a chain thing and a challenging thing. So it is about keeping our brains sort of turned on, really, that we're learning new things, but we're learning things that we want to learn. And that can be something that can be challenging for young people to talk about, because they'll be like, well, I'm in school all the time, so I'm learning all the time. It's like, well, actually, what do you want to learn? So this isn't about your maths and your history and your geography. This is about setting goals for yourself, and so whether that's about kind of improving your tackling or improving your defending, or whether it's about something entirely different, what's something new that young people can learn that keep them kind of engaged and interested and help them to have that sense of achievement. And then give. So what have you done recently to make someone happy or to help others? And I know a lot of sports clubs come together and do kind of charity things all the time, and that's brilliant. And so that can be part of your give, or it can be the simple things. It can be taking time, an older player spending time kind of helping out the coach with coaching younger kids. It can be, just if someone on your team is having difficulty with a skill, spending a bit of time helping them to get to know it. It can just be making someone a cup of tea. It can be, any of those kind of small kindnesses, just checking in on someone who might be having a hard time. So it is that idea that doing good helps us feel good, and that's really important for us and our mental health. The other thing that we talk about when it comes to promoting and or supporting the mental health of young people is just how important listening is for young people, and just how important it is to be able to listen kind of actively to young people when they're going through something difficult. And people who are listening well, it involves giving time and effort. A good listener doesn't judge, they don't rush to fix the problem, they just listen attentively and they give their undivided attention. And we go into this a little bit more as well in the course. I wanted to play a quick animation for you, and it's not one that's in the course, so this is like a kind of a special one just for you who tune into the webinar. But it's about this concept that we've developed called the RALI concept. So RALI is an acronym, and the video goes through what it stands for. But it's another kind of a tool that we give to adults who work or volunteer with young people when it comes to supporting young people. How can I support a young person that I think might be struggling with what's going on for them? So I've done all the 5 a day, and I've done all the promotion, but actually I think that there's something going on for this young person. How can I support them? So the RALI is one way that we have, and the reason why we have the word RALI is that when a young person is struggling with their mental health, as a community and as adults, we should rally around them. So that's where that comes from. So I'm just going to play that video for you, and I think you might find it quite interesting.
I'm here.
I'm here.
I'm here.
I'm here.
We're here for you.
We're all here for you.
One way to really be there for young people is to rally.
Rally, when people come together in order to help. For young people, those who often rally to give support are their one good adults. Young people have let us know of the importance of having a supportive adult in their lives.
These one good adults can be anyone in a young person's life that they trust, such as parents, coaches, youth workers, teachers, other family members and their peers, to name a few.
Young people helped Jigsaw develop the rally approach. Each letter in the word rally stands for ways we One Good Adults can support young people.
Or, recognise the signs. Signs that something is going on for that young person. We might notice changes in a young person's behaviour. They might be withdrawn or might lash out. They may not be able to concentrate. We might spot changes in appetite, sleep, or signs of self-harm, or that their social relationships have changed abruptly. What we One Good Adults notice is often just the tip of the iceberg.
A. Acknowledge them and what they're going through. It can be helpful to let a young person know when you've noticed they haven't seemed their usual selves. Keep it casual, but let them know you care. It does make a difference.
L. Listen. One of the most important things for a young person is to feel listened to. Talk less, listen more. Do, listen, give time, make an effort. Don't, judge, belittle, diminish, make promises you can't keep, or use cliches. Listening is about letting the young person talk and, for the most part, staying silent.
L. Let someone else know. We don't want to break a young person's confidentiality, but we need to be aware of our own boundaries and our limitations. There is always a limit to what we can know and what we can do. If we think a young person is at risk, then we have to let someone else know. We should seek advice and ask for help, especially if we get overwhelmed. Reach out to those around you.
Why? Your response. It really matters. When we respond and how we respond is very important. Try to remain calm and prepare to hear anything. There are lots of things we can do. We can ask how we might help. We can reassure the young person that we hear them. We can also move the focus onto things that are going well in their lives without dismissing their issue.
I'm here for you.
We're all here for you.
So that's kind of the rally concept basically, and it's just another way of thinking about it. You can find more information around that as well on jigsaw.ie around the rally and around different areas and around different things that you might find helpful in your work as coaches, or some of you are probably parents, and I'm sure lots of you are aunts or siblings or older brothers and uncles and all the rest of it. And I think it's very hard to find anyone who doesn't have a young person in their life that they could be someone to talk to. So I hope that you found the last, how long am I 40 minutes? Am I under or over? I think I'm just under. But I suppose I hope you found that useful. I hope you found it interesting. And I really hope that you enjoy the course as well. If you have any questions, please feel free to send me an email on rebecca.murphy@jigsaw.ie. I know Niall and Ross will probably be in touch with kind of details of how to log into the course itself. But I'd love to hear any questions and any feedback that you might have as well. And there is a feedback form within it, so we would love to get your feedback on it, and so that we can make it better, and that we can find out what's working and maybe what isn't working so well. So thanks a million. Thank you.